Hey everybody, this is Dr. Matt Joosse at Joosse Family Orthodontics in Williamsburg, Virginia. We provide braces and Invisalign treatment to our great patients. This is a wonderful, wonderful patient because she's the mother of some kids that I've treated, and I always love treating the mothers and the fathers of youth patients because they've sacrificed so much for their children, and now it's their turn to have the smile that they want. So I want to show you a little bit about this case because this particular mom came in, she wasn't happy with her smile, and she recognized that her teeth were being very worn down. You can see a lot of uneven edges of these teeth. She's aware that she does some clenching or grinding. She's also aware of this little space that has kind of developed right in between her two front teeth. And she just wanted to know if there was anything that can be done orthodontically. So one of the things that I explained to her was that when upper front teeth overlap lower front teeth excessively, so when they overlap excessively in a vertical way, that predisposes the teeth to being worn down prematurely because the front teeth are taking too many of the forces in the bite that they're not really intended to take. So one of the ways that we treat that is by making sure that the upper front teeth overlap the lower front teeth less than they do currently. And you can see that in the finished result over here, that you can see more of the lower front teeth when we were finished. But there was also some crookedness of these upper front teeth as well. So we got her well aligned, and there's actually more crookedness of the lower front teeth that you can't really appreciate from this picture, but that's not really what I wanted to focus on for this particular case. So after the teeth were well aligned, we did a little bit of reshaping of some of these teeth, and so that you can see that I made these front two teeth more symmetric in shape. To this tooth right here, I actually bonded in a little bit of filling material so that we could fill the chipped tooth that was there, and we tried to make it as symmetric and possible to shape as its counterpart. And the same with the next two teeth. We rounded out some of the jagged edges that were present and tried to make them more symmetric as well. In addition, this little space between the two front teeth, we got that closed so that it doesn't look like she has food stuck between her teeth anymore. And overall, this is just a great result. She was loving her new smile. We gave her a healthier bite because the teeth overlap less in the front, so she should be less inclined to wear these teeth down. And we gave her great retainers that even if she does some clenching or grinding, it's going to protect her teeth. So overall, really, really happy with this result. Again, I love treating parents and family members of current or old patients just because it's always nice to see them doing something for themselves. So really happy about this healthier bite and this beautiful smile, and we're looking forward to doing the same for you. Thanks so much.